Talking about the risk stratification tools in sarcoma, the most convenient tool we have is Circulator, which is thought for localized disease, which obviously this is the most important setting because it's the most frequent setting at diagnosis. 70% or 80% of patients at diagnosis has localized disease. So this is important to establish what is the risk of recurrence and what is the risk of dying for the disease. And in this sense, there have been several attempts to stratify the risk of metastatic recurrence or any recurrence in general. But again, I think the most validated tool and the most personalized tool is the Circulator, especially for sarcoma patients of limbs and trunk wall, and also for retroperitoneum. So in this sense, I am routinely used in clinical practice, and usually we apply the threshold of 40% for the risk of death by sarcoma at 10 years, which is something that Circulator is giving us applying this tool. This is the threshold we are usually consider for the recommendations of perioperative chemotherapy in the context. Just this is in the context of soft tissue sarcoma in the extremities or trunk wall within the let's say the most sensitive subtypes or within the most frequent subtypes in these locations. And essentially, this in our case is considered for patients with UPS, synovial sarcoma, myxoid liposarcoma, leiomyosarcoma, and MPNST. These 5 subtypes represent 80% of primary sarcoma tumors in limbs or trunk wall. And this kind of sarcoma have been enrolled in clinical trials. So for patients having these subtypes, we have more information, and then we can make more advice. So this is a case. There are obviously different scenarios. We are not talking here about the GIST, for which we have the heat maps of Heikki Joensuu, which is the most powerful personalized tool of risk stratification. But depends on the tumor. We will have different risk stratification, which is the case of solitary fibrous tumor, which required another approach, different approach. So, but in general, talking in general, for localized disease, we have, especially in the extremities and trunk wall, and this Circulator, and also for retroperitoneum, which is, I think, is very useful.